Welcome to the Social Emotional Learning and Crisis Response Practice Guide Orientation webinar. The link to the practice guide is available on the top of this page and your participant notes. Through this orientation, you will gain background knowledge on the development of the North Carolina Department of Public Instruction Social Emotional Learning and Crisis Response Practice Guide. You will consider the teaming structures and key products to support this work. You will preview the layout of 7 recommendations, share your questions, and experience the 3 signature practices, which are welcoming inclusion activities, engaging strategies, and optimistic closures.
Hello, everyone. My name is Lauren Holohan. I am the coordinator for our state systemic improvement plan for students with disabilities. I also support Medicaid reimbursement for local school districts and charter schools, and I help coordinate our work around school mental health, both within the Exceptional Children's Division and across the agency. And I'm excited to be able to introduce you to this tool this afternoon.
And I'm also excited to be with you. My name is Beth Rice, and I'm with the Integrated Academic and Behavior Systems Division at DPI, and I'm a practices lead with that division. Our state is also a part of CASEL's Collaborating States Initiative, and I lead that work. All right, so we want to start with making you aware of some of the webinar resources. So participant notes have been developed, and this is a supplemental resource to support processing the content of this webinar. Participants are invited to use these before, during, or after the webinar to access the resources, review the content, and engage in asynchronous collaboration with others across North Carolina. All materials for this webinar are available on the SEL and Crisis Response Practice Guide site, which is the same link that was on the previous slide. And you'll also see here linked at the bottom of your screen a direct bit.ly to the practice guide participant notes.
Hey, Beth, it's also true, isn't it, that this whole PowerPoint plus the webinar plus the practice guide will be uploaded to the practice guide website. And if folks are to open this PowerPoint, there's lots of hyperlinks throughout right there on the screen.
We are giving you it all, and we hope that this helps to support you as you communicate and use these resources. Okay, so we're going to get started with a welcoming inclusion activity. And certainly we want to welcome everyone into this time of learning together, and we're going to use a welcoming or inclusion activity. And when used consistently, we know that these 3 signature practices, and one example is the first example is a welcome and inclusion activity, that this actually really helps to create a solid foundation of safety, consistency, and even joy in adult learning environments. And we think right now it's an especially important time to help create that sense and that feeling. And this is something we've been doing across our different opportunities within DPI, and certainly want to invite you to experience the same thing. So you can use the link or the QR code that's found in your participant notes to post your response to the word cloud activity. And for this activity, you're going to, in one word, name a strength that you've discovered in yourself or your team as you've responded to this crisis. And we're going to go ahead and give you about 1 minute to think about that. You're welcome to go ahead and respond using the link in the participant notes. And then after you do that, you can go ahead and look at the results from across the state. So we're going to pause, and actually not 1 minute, about 30 seconds to think about one strength that you've discovered in yourself or your team as you respond to this crisis. Oops. And if you would like to see what others have shared across the state, just click View Results within your participant notes. So next we want to share some background on the development of this practice guide. So the practice guide was developed by the COVID-19 Social Emotional Learning and Crisis Response Work Group, which included input from Project Aware sites. And we are really grateful for the insight and hard work that was contributed from this work group. The practice guide connects with existing social emotional learning and school mental health work that is already moving in districts and schools. And it enhances this work by bringing social emotional learning as a priority after only physical health and safety of staff and students. You have 2 flyers in your participant notes. Both can be immediately used to help communicate prioritization of social emotional learning. In November, North Carolina joined CASEL's Collaborating States Initiative. We formed a North Carolina Social Emotional Learning implementation team and began focusing on systemic key resources to move social emotional learning forward. In March, we released this North Carolina SEL flyer. This flyer highlights key resources for both teams at the district and school levels and individual educators. It also highlights upcoming resources, including social emotional learning standards mapping across 12 content area standards. This resource or these resources will be released in July. Following school closures in March and the forming of state guidance, we shared a North Carolina Department of Public Instruction Social Emotional Learning and COVID-19 flyer, which again pointed folks back to the same key resources and some additional COVID-19 specific resources. With this work, you will make connections and build on existing work with a focus on social emotional learning and school mental health. So now we want to just pause and provide an opportunity for some reflection. So this is an example of an engaging strategy. So as you reflect on your district or charter school's work around social emotional learning and school mental health, what are your greatest assets? You can use the link or QR code found in the participant notes to post your response to the Flow Grid activity. For this activity, you will post a brief 250 character or less response sharing your greatest assets as you consider your current work around social emotional learning and school mental health. We're going to give you 1 minute to go ahead and think about your reflection. And you're welcome to go ahead and post your response. Okay, and we would love to invite you to click the View Results Here link to see what others have shared across the state. So implementation support for the practice guide will be provided through a cascading system of support. And this is aligned with our North Carolina MTSS teaming structures. At the state level, implementation will be supported by the North Carolina Social Emotional Learning Implementation Team. At the regional level, the regional support team will provide support. At the district and school level, we want to empower you to utilize your existing MTSS teaming structures. For example, start with your district multi-tiered system of support team or leadership team. Does it include representation from specialized instructional support personnel, which would be school counselor, school psychologist, school social worker, school nurse, behavior support, and crisis response team representation? If not, who can we add to help support planning for social emotional learning and crisis response as students come back to school? Additional members that we would certainly want to include at the district level include our coordinators for MTSS or multi-tiered system of support and PBIS, positive behavior intervention and support, or your behavior intervention system, whoever is doing that work. Social emotional learning and school mental health, you might have a coordinator or a contact person that's doing that work. And so we definitely want to include those members. We want to make sure the voices that have already engaged in the work are represented. And this will help to prevent duplication of previous work in a really critical time. You'll also want to consider how students and families are represented in this work. Student and family voice and engagement is critical within this work. Guidance for MTSS teaming structures is linked in the practice guide. It looks just like what you're seeing here on the page. It's also linked in your participant notes. All right, and so we would like to go ahead and pause and again engage in an opportunity to process through an engaging strategy. So we want you to take a moment to reflect on your district MTSS team or your charter MTSS team. Does your current district MTSS team or charter MTSS team have the expertise to do this work? Do you have the voices that you need? And again, we're going to pause for about 1 minute for you to start doing some of that reflection. Now we're going to start looking at some of the layout of our recommendations.
So, yeah, we want to give you a sense of how the practice guide is organized. And starting at the home page, which is what we're looking at here, the screenshot, the social emotional learning and crisis response practice guide is built around 7 recommendations. So, links to these recommendations can be viewed in the navigation menu over there on the left or on the home page in that navy blue band. You can see we've kind of highlighted that for you. The recommendations can be viewed and the resources within each one employed really in any order. It's just based on what your local need is. Recommendations 1 through 6 address crisis response and social emotional learning while schools are closed or providing remote instruction, both now and in the event of rolling closures in the 2021 school year. Recommendation 1 and 2 will walk you through a needs assessment and resource mapping to help prioritize social emotional learning and mental health supports. Recommendation 3 and 4 support how to do check-ins with students during remote instruction and how to respond if social emotional learning and mental health needs are identified. Recommendation 5 provides guidance on setting behavioral expectations for remote instruction. And then 6 highlights strategies for supporting adult social emotional learning and mental health. And we know what we're learning from other states and our national um, collaborating states initiative is that focusing on adult staff social emotional learning and mental health is critical to being able to provide those same supports to students. And then finally, recommendation 7 really focuses on key social emotional learning strategies that will support safe and compassionate reentry for students and staff when brick and mortar instruction resume. So let's look at an example of what you can find on each of these second 7 recommendations. Each recommendation begins with a description, which includes multiple links to enhance background knowledge of the subject. For instance, with recommendation 7, guidance on reentry from several national associations are linked in the introduction. Next, we've identified clear, concise action steps and resources to carry each of them out. Districts and charter schools are encouraged to customize these action steps and resources to meet their local needs. And we probably should have said at the very beginning that the practice guide is offered as completely as a resource and a support. There's no requirement that the recommendations in the practice guide or any of the resources be implemented. This is to help you move through the barriers in meeting both the social emotional needs of staff and students. And then additional resources can be found for each section at the bottom of the page. There's also a section you'll see for each recommendation where we've tried to imagine some potential roadblocks and solutions, and many of those suggested solutions also contain resources for implementation. Back on the home page, at the very bottom, near the very bottom, there is a key products link. You can see it's circled there. When you click on that hyperlink, it will take you to a summary of all the resources that are linked throughout the site. And many of those resources are example from our project aware districts, which include Cleveland County, Beaufort County, and Rockingham County. These are districts that are serving as pilot sites for a SAMHSA funded effort to improve social emotional learning and school mental health supports. We also gathered resources from other LEAs who are implementing social emotional learning and behavioral health supports within and under their MTSS framework. So again, you can find the link for the key products just under the list of recommendations on the home page of the practice guide. So district and charter school MTSS teams are encouraged to explore the site following this orientation. We would love for you to just spend some time and wander around in it, maybe even as a team. And then once you're familiar with the layout and the resources, that you're going to find that some of those you're able to apply immediately, right, and they will fit right in with your local MTSS implementation plan. Other resources may require more implementation support and technical assistance and coaching, and we're aware of that. So in the coming months, DPI will be hosting regional social emotional learning and mental health implementation support sessions. Those sessions are going to be largely designed around the questions we receive on the question and answer page of the practice guide. So we just wanted to highlight its existence. Again, it's linked at the very bottom of the home page. There's places there to submit questions. We will be kind of routinely updating an FAQ document so you can see the questions that have already been asked. But just a really strong encouragement to say that the questions you ask there will be how we structure ongoing implementation support. So links to the question and answer page can be found again in the navigation menu on the practice guide and on the home page. On the question and answer page itself, you'll find a frequently asked question document, as well as a place, like I said, to submit your questions. We ask that you just submit one question at a time in that form. And remember, we'll be using this tool again to guide the support provided to the field. So this is a great way for us to learn what your needs are. And so as we end this webinar, we'd like for you to consider the content that was shared during this session. We know lots of ideas and resources and information exist within the practice guide, and we've given you a tiny peek of those in a short amount of time, and that you're going to need lots more time to explore and process what's in the practice guide. But even during just this quick peek, wondering what treasure did you see that you're excited to go back and explore more deeply with your team. You can use the QR code or the link that's again in your practice or your participant notes to open the thought bubble activity and respond to that prompt. What information or resource did you see or hear today that you're most looking forward to exploring further?
Maybe we'll give just a moment to think on that.
Sure.
And I can do just a little bit of background music, I think. We're going to try that. Okay, so just as with the other activities, if you're interested in not only submitting what that you found, but also seeing what others are excited about, just click on that View Results Here link. And Lauren, the other thing that I was just thinking about was just sharing with you all that we are really hopeful about this work and really grateful for this opportunity to support you in this work. We have teams that are very excited as well about that, and just really look forward to getting in this together.
Yeah, and I will add in closing that the practice guide was built with a whole armada of very talented and dedicated people, and they are acknowledged at the bottom of the homepage. If you click on acknowledgments, you can see the wide range of stakeholders that were involved in the development and who will continue to. The site is a dynamic site, and we will add to it over the coming months. So we hope it's a good place for you to start with thinking about the social emotional needs of your students and staff. Thank you all.
Thank you.